I think it's pretty easy for many providers to have a bias and not recognize perhaps that a patient has a different sexual orientation, or maybe what was going on at the last visit may be different at that visit or the new visit. They may have had a change in a sexual partner, or they were previously in a monogamous relationship and they no longer are.
So some common biases that providers may experience or unfortunately have their patient experience. Number one, that young adults should not be having sex. And so those may come through in the questions or the lack of questions as they seek to get clarity, or they may just avoid the topic altogether because they're uncomfortable or they fear what the answers are going to be. They may not be equipped. And so some of that may not just be that they don't want to discuss it, they may not have the right information. And if that's the case, then it's important for you to get educated on the topics that are necessary to make yourself feel comfortable and your patients feel comfortable.
In today's day and age, there are a lot of biases when it comes to women's healthcare in general, let alone sexual healthcare. Some of the most common biases is that some people aren't having sex. Some people don't know that they're allowed to have pain-free sex. The bias there is that we're not obliged to ask about it.
I feel that whenever we are providing sexual health care, there's a lot of preconceived notions that clinicians can have oftentimes. Sometimes the assumption of a monogamous relationship, for example, can be one of them. And not really acknowledging other types of relationships that may exist can be a really difficult topic to navigate. This is especially true if it's on the patient to educate the provider about what their own sexual practices and also types of relationships might be. So for example, assuming the gender of a patient's partner can be very limiting in terms of the history, and sometimes can intimidate the patient into thinking that this is not a safe space for them to be themselves.
How can providers establish a judgment-free zone? I think really trying to be mindful of their own practice and how they come across with their patients. So really checking their own selves before they go into that encounter and reminding themselves that every patient has a different life experience and different expectations of office visits. I'm going to readdress some of those questions because their life circumstances may have changed from the last time they were seen. So many things can happen, whether it's changes in family structures, divorces, relationships breaking up, new relationships, change in jobs, moving, sexual assault, things that may have happened since that last visit.
I think creating a judgment-free zone for patients feeling safe about their sexual health starts at the very beginning of the clinic visit in your front desk. Having literature in which they see that this is something we routinely talk about. For the LGBTQ+ community, having some representation with some stickers, rainbows can be really affirming. Making sure that you have gender-neutral forms in your intake that do not specify husband or wife, but instead maybe partner. And then making sure that everybody in your staff is aware that sometimes patients can have a really difficult time talking about these things. Allowing the patients to fill out forms separately and in their own time so they can actually prepare the information they're ready to share with you ahead of time can be really helpful.
We often use the words of like, are you sexually active? But what does that actually mean? And so many people don't understand that. And so I'm oftentimes very concrete. And so I'll say, are you having sex? And by sex, I mean anything more than touching. Are you kissing? Are you having penetrative intercourse? And so being a little bit explicit. It may lead to some giggles or laughs or feelings of uncomfortableness. And I explain this where I don't need names, ages, complete details, but I do need to have an idea of what body parts I may need to test as I'm providing care for you today. For example, if you are engaging in receptive oral sex, we may be doing a throat swab for infections. So I think it's really important that you feel comfortable yourself talking about these things, using the exact terminology, but then recognizing that a patient may have a different name for terminology of body parts. And so you have to always ask back, like, do you understand what I'm saying there?
So instead of asking them if they're sexually active, which for some may just mean penis and vagina or just very specific actions, I ask them if they have any partners that they're intimate with. I think that the word intimate can really relate to other ways in which they can be sexual, and it can allow you to peel away some of the different sexual behaviors that might be a little riskier than others. And finally, when you're finally seeing the patient, making sure that you're asking open-ended questions and following their lead in what they are comfortable sharing with you.
Some patients may ask, what is sex? And then you have to break it down. Okay, you have to discuss body parts and which body part is going to which body part. So it's really important, and just know it may make you feel uncomfortable. You'll be out of your comfort zone, but if you use generic terms or terms that you think the patient may know about without explaining, you may not be getting the information that you need. The other part in terms of creating that judgment-free zone is not to overreact when you hear information that is given. Ask clarifying information or just document. But patients are sharing that information with you because you asked. And so what you do with that information is important. Don't judge. Just ask, get the information, provide the information, and do your appropriate standard screening.
When asking about partners, the language you use is very important. So instead of saying, hey, do you have sex with your husband? Maybe asking, hey, are you sexually active with any partners? And by allowing that S at the end, partners, you open the possibility for the patient to tell you if they have more than one partner. Sexual health and gender identity can overlap in many different ways. Whenever we're talking to patients, especially new patients in different settings, I always like to first check in with them and ask them, hey, I'm Dr. Ramayo, I use he, him pronouns, what's your name and your pronouns? That is meant to do two things. One is to allow the patient to know, hey, if there's something more about your identity that I should know, this is a great time to share that with me, and we are open to listening. And then the second thing is, if the patient is like surprised that I'm asking that question, asking me, why are you asking me that? It's a great time for education, just to let them know this is something we ask all of our patients to make sure they feel comfortable in our clinic. So it takes 2 seconds. It is something that is very easy, and it can definitely advance your doctor-patient relation leaps and bounds by creating that environment of trust with your patients.
So one method that I use to ensure that I stay non-judgmental for any information that is shared by patients is to remember why I'm there, why I'm asking the question. They're coming to see me, they're coming to see you as a knowledge source. And so even if you may disagree with the practices that they may be engaging in, as they may be putting themselves and others at risk, it's important that you help them figure out ways that they can still explore their sexuality, as is their choice, but also do it in a safe manner.